everybody, it's Dr. Amir Rashidian at Mid-Atlantic Chiropractic Center, and today we're going to talk about something that's probably on your mind, and you've probably wanted to ask this question, but you may not have asked it, or you asked it and no one gave you the correct answer for it. And the question is it safe to have my neck adjusted by a chiropractor? First off, it's the right question to ask. Secondly, should you be concerned that someone might hurt you? Yes, you should be concerned. Is it intelligent to do your research and find out? 100% it is. In fact, if you're going to put your neck in someone else's hands, those hands better know what they're doing. And I also would want you to feel perfectly safe doing it, because if you don't feel safe and you're worried and you're scared, well, you may not get a good adjustment anyway. So even if it doesn't hurt you, it certainly won't benefit you, and you don't want that either. So is getting chiropractic adjustment safe to the neck? Let's talk about that. Depends on who you ask, right? If you ask a chiropractor, first off, you know what? Do not get your neck adjusted by anyone other than a chiropractor. The barber shop, the people there should not be adjusting your neck. Anybody else, a massage therapist, they have different specialties and they're experts at other things. So the people who are experts at adjusting the spine, especially the neck, are chiropractors. So make sure they have the right credentials, certifications, and they're licensed to do what they're doing. That's number one. Number two, though, is what is the risk? Can I get hurt? Can I get injured? Can it kill me? Well, the answer to all those things is anything can kill you, and anything does have a risk. There's a risk to everything, but believe it or not, there's a risk to not doing things also. So let me show you this spine right here. I'm going to explain this to you in detail. You're going to love this. This is Charlie. Charlie's not a former patient. Charlie is a plastic model of the human spine. And when you look at the spine, you've got vertebrae and discs, and then you have nerves that come out of the spine. These are the nerves that are connected to the brain. So they pass through the spine, come out, and go to various organs, glands, and tissues of your body. Now, even blood vessels are controlled by the nervous system. When you look at the neck, right here, these top 7 bones, that's the neck. And notice this red thing right here that comes down. This actually is a blood vessel. This is called the vertebral artery. Now, a lot of people talk about the carotid artery in the neck. The carotid artery is outside of the spine, but the vertebral artery is in the spine. And that's the one that people worry about. Now, notice anytime the curve of the neck is reduced, that artery can be stretched. In fact, research shows that reduced curvature of the neck will reduce blood flow to the brain. Now, if you don't want less blood flow to the brain, that needs to be corrected. So it's actually more dangerous to not have the proper curve in the neck than to have it corrected. Another thing is, if any of these bones are misaligned, and that should only be seen on x-ray, so I 100% rely on x-ray to find out if something's misaligned or not. If it's misaligned, it's going to put tension on that vertebral artery, and removing that tension is going to make you healthier. So if the proper analysis has been done, the lines have been drawn, the measurements have been made, and you know the chiropractor knows which bone they're adjusting and in what direction, an adjustment actually safer than not getting adjusted. And it cannot hurt you, only if it's done correctly. Now look right here, I've got a picture of a pre and post x-ray. This is a young lady, not so young, we'll call her young. She's got a giant bone spur right here. Her neck does not have the normal curve. In fact, this red line represents the normal curve of the neck, but the neck that she has is really straight. That bone spur tells me that this problem's been there for at least 15 years, probably longer. Now, after about a year of chiropractic care, you notice she's got a perfect curve. The bone spur is still there, unfortunately. We can't get rid of that, but we can't prevent it from getting worse. We can't prevent the other bones from growing bone spurs. And now she has normal blood flow to the brain, as well as less tension on the spinal cord and less tension on the nerves that come out of the brain that control the body. Anyways, I hope that was helpful. Do not be afraid of the adjustment, but do your research. Make sure you go to the right chiropractor for the right reasons. Take care. I'll talk to you next time.